Welcome to the Pathfinders Academy. My name is Daniela Gill and I am representing the Clinical Laboratory Science program. The Clinical Laboratory Science program falls under the College of Health Professions under the Department of Health and Biomedical Sciences. The Clinical Laboratory Science program faculty includes our program director, Mrs. Sandra Tijerina, clinical assistant professors including Ms. Aguirre, Ms. Villarreal, Ms. Briones, and myself, Ms. Gill, Assistant Professor Dr. Andetta, and Associate Professor Dr. Gilkerson. The objectives of this presentation is to go over the Clinical Laboratory Science profession, the CLS program overview, our requirements, and the roadmaps for completion. The profession. We are known as medical laboratory scientists or medical technologists. We are highly skilled scientists who discover the presence or absence of disease and provide data that help physicians determine the diagnosis and treatment for the patient. Although we are not involved personally with patients, we play a crucial role in the process of providing personalized care. We generate vitally important data for identifying and treating cancer, heart disease, liver disease, diabetes, infectious, immunological diseases, and many other health conditions. The job outlook for the CLS graduate includes a median pay of approximately $53,000 a year or $25 an hour. The clinical laboratory science profession has an increased job outlook of 11% from 2018 to 2028. This can be attributed to the increase in demand in laboratory services and technology advancements such as molecular or genetic testing that require educated, skilled professionals. Medical laboratory scientists are the first-line essential responders testing for the novel coronavirus, also known as COVID-19. There are many career opportunities for a CLS graduate, and it includes being employed in a hospital clinical laboratory, commercial or reference laboratories, public health laboratories, pharmaceutical or chemical industries, biotechnology companies, forensic and law enforcement, veterinary clinics, research and teaching institutions, transplant and blood donor centers, fertility clinics, cosmetics or food industry, and it can also serve as a foundation for graduate education in healthcare. Graduates can apply for a doctorate in clinical laboratory sciences, medical school, physician assistant school, healthcare administration, and many others. Our program overview is the clinical laboratory degree will prepare our students for certification and employment as medical laboratory scientists. Our graduates are part of the healthcare team and play a vital role in the prevention, diagnosis, and treatment of disease through the performance of laboratory tests. And as we mentioned earlier, it is an excellent undergraduate option for those planning to go to graduate school, physician assistant program, medical school, dental school, anything higher education. Our requirements to apply for the Clinical Laboratory Science program, we require a minimum GPA of 2.0 and a minimum science GPA of 2.0. When a student needs to have its core courses completed, and we have additional required science courses which include general biology, anatomy and physiology 1 and 2, clinical microbiology and healthcare, elementary statistical methods, general chemistry 1 and 2 with labs, and organic chemistry 1 with lab. This is a timetable overview of once the student is accepted into the program. The student will complete the program in a 15-month, and the first 9 months are on campus where they are taught the didactic courses. They will start in August and it will go into May, and that is considered their junior year. At this point, the students will learn the basic theory and techniques necessary to function in a clinical laboratory. The core courses include hematology, which is the study of blood, white blood cells, platelets, clinical chemistry, blood bank and serology, microbiology, and urinalysis. After their first 9 months, we have the clinical rotations, which take place from June to December, and this is considered their senior year. At this point, the students will apply the knowledge and skills gained on campus to actual patient care situations. We are affiliated with hospitals throughout the Rio Grande Valley, and our students go to do their clinical rotations there. So, who is a successful student? Who is more likely to get accepted into the clinical laboratory science program? Students who have a good admission profile have a GPA of 3.0 or higher in their science courses. They have completed 14 hours or more per semester. A student with high level of critical thinking and complex problem-solving abilities. Student with dedication and determination to achieve and excel in the program's rigorous courses. And the student that has the ability to multitask and maintain composure under pressure. What are some common issues or concerns in regards to the clinical laboratory science program and career? Common concerns for those in the healthcare field include being exposed to pathogen and infectious disease. It is required for CLS students and graduates to have proof and up-to-date immunizations, including but not limited to having your full set of hepatitis B, varicella, measles, mumps, tetanus, diphtheria, rubella, and the influenza immunization. Students will learn about laboratory safety and how to decrease probability of exposure, and the CLS program and hospital laboratories adhere to strict safety procedures and must comply to OSHA requirements. Some of our resources include the American Society for Clinical Laboratory Science, AACP, which is the American Society of Clinical Pathology, and our local Texas Association for Clinical Laboratory Science. And you can get more information about the profession through these resources. Frequently asked questions in regards to our program. Do you need to take a test to work in this profession after graduation? And yes, graduates must sit and pass the American Society of Clinical Pathology, also known as AACP, board examination to become certified. Certification must be renewed every 3 years. Are there jobs available for medical laboratory scientists? Yes. There is a nationwide shortage of medical laboratory scientists, and most of our students find jobs within 1 month of graduation here in the Valley. What is the approximate annual salary for graduates in this program? We have gone over this in the previous slide, but they are entry-level graduates and they can earn somewhere from $46,000 to $60,000 a year if they're employed full-time. This does not include sign-on bonuses, benefits, or overtime. Graduates can increase their salary by working evening or night shifts, which also carry a monetary per hour differential. If you have any questions in regards to the Clinical Laboratory Science program, you may contact us at any time. We have Ms. Sylvia Garcia as our administrative assistant. We are located in the Edinburgh campus, and you can reach her through her email, or you can call us to our office. I would like to thank you and look forward to having more interest in the clinical laboratory science field. We're in desperate need of more medical technologists, as in the current situation with the pandemic of COVID-19, we would like to have more people in the laboratory performing these tests. Thank you so much, and if you have any questions, you may contact us at any time.